Today is a challenging day for pharmacies across the country. Today is Friday, May 26th. Today is a deadline to determine whether or not pharmacies across the country are going to accept a Medicare Part D plan by a giant PBM that controls an enormous amount of the patient care market in the United States. The puzzling thing is you don't normally hear about this as a patient or a customer. The reason I'm sharing this message today is because this particular PBM has drawn a line in the sand. There are no negotiations. It's take it or leave it. So if we accept this contract today, we will lose money on every single prescription that we fill for brand name medications in 2024. So what that means is when we buy medications from our suppliers, we would be paying more for that medication than this insurance company is going to pay us for brand name medications. Brand name medications are medications that don't have a generic in the marketplace. They don't have multiple sources like, furosemide or atorvastatin. While only about 10% of the patients take medications that are brand name, it is an enormous amount of the dollars that are spent in healthcare right now. And as a result, it's become a huge problem for patient access. Pharmacies across the country are making a decision today whether or not to accept this contract. And anybody who's a business owner listening to this message will understand that it doesn't make good sense to sign a contract and make a deal where you're going to have to pay more for a service than you get paid in return for providing it. So we are faced with a very difficult situation. As a pharmacy and pharmacist, my family's company has provided service in this area in Ohio for 47 years. We've taken care of patients for decades. We've built relationships that have been so rewarding and so satisfying to be able to be part of the healthcare team. But the reality is there are giant corporations that are controlling healthcare that you are paying for that are making it very difficult for us to take care of you as the patient in the way that we want to take care of you. So all I can say is you need to ask questions of your benefits coordinators, you need to ask questions of your insurance companies, and you need to make sure you're well informed because we have a situation in this country that is getting to be very tedious. And in 2024, mark my words, there's going to be a situation where certain patients are going to have less access to care because of this particular insurance company basically not being willing to negotiate and not being willing to pay a reasonable dispensing fee for us to provide service to you. So we value you at the Medicine Center Pharmacy. We want to be part of your healthcare team. Every day we're looking to provide services that are missing in the market or where there's gaps in care. But we have to make decisions that will not only keep our doors open, but also take care of the patients that we can still take care of for plans that are paying us in a fashion that allows us to make ends meet. So if you have questions, please put them below in the chat. I want you to know that this has been a very challenging week for pharmacies across the country, and we have to make sure that we communicate with our elected officials so that we can make change and improve access to care for patients. Thank you.